Too many women are putting their lives at risk by failing to get tested for cervical cancer. NHS England says it's the most common cancer in women under 35 and largely preventable thanks to the cervical screening test. Yet the numbers being screened across the south are falling each year. Across Reading, Portsmouth and Southampton, almost 1 in 3 women miss their test. In Oxfordshire, the figure is 27%. And in West Sussex, the figure is around a quarter. Nikki Mitchell has spoken to one woman who owes her life to taking the test.
It is life-changing, but at the end of the day I came out of it okay.
It was a routine smear test which led to Catherine Holtom discovering she had cervical cancer.
I remember crying and having to tell my mum and my mother-in-law and our friends that there was actually something quite seriously wrong.
Surgery, chemotherapy and radiotherapy followed. The treatment worked.
I do think there must have been someone looking out for me, because it just so happens I was due a smear test, and I would hate to think that if I wasn't due that test, how long I would have gone without seeing any signs or symptoms.
Catherine lives in Holtom in West Sussex. Here, 1 in every 4 women are ignoring their reminders to book a test. In Reading, Portsmouth and Southampton, 1 in 3 aren't bothering.
I'm quite shocked by that, actually. Perhaps a lot of them work, perhaps they just don't find the time for it.
It's not a very nice experience, but it is very important.
Just a bit embarrassing, really, I think.
Younger women are offered tests every 3 years. For the over 50s, it's every 5.
We are hugely concerned, and actually we're really keen to reach the first age of cervical screening, so the 25 to 29 and the 60 to 64-year-olds, because they are particularly poor attenders.
It's something that is offered to us on the NHS and could be life-saving, so please go.
Catherine's treatment has left her unable to have children, but she has got married to the man who supported her throughout.
My husband said, you know, it doesn't matter about the children, it's about saving you, making you well.
Well, earlier I spoke to Nigel Atchison, NHS England's medical director for the south of England, and I started by asking him what they were planning to do about the fact so many women are missing their smear tests.
It's a real concern, and there's a real opportunity through campaigns such as this to raise awareness of the importance that women, when that letter drops through the letterbox, offering them an invitation for a cervical screening test, that they find the time to pop along and have it. We have a screening system in this country which is able to detect a change in the neck of the womb before it becomes cancer and offer treatment which can prevent women getting cervical cancer, and that's really, really important, and that getting that message across is really critical.
But what's also key is women aren't taking that opportunity. Up to 1/3 of women are missing out. How are we going to encourage them?
I think there's no question that we need to educate women. Campaigns such as this are ever so important. Allied to that, you'll be aware that for Year 8 schoolgirls, we've now got a vaccination against what we call HPV, or the wart virus, which is the cause of those precancerous changes and then cancerous changes. Talking about this, highlighting the fact that there is a test that women can access which can dramatically reduce their chance of developing cervical cancer is really important.
So you think it's an educational issue?
I think primarily that's the case. I think that we need to try and overcome the fact that women are really busy, and sometimes it could be difficult for them to arrange the appointment with the practice nurse for the screening test, or perhaps they think it's a little bit embarrassing, but it's ever so important. And the other thing that it allows us to do is raise the fact that smoking increases the risk both of precancerous changes on the neck of the womb and indeed cervical cancer.
Mr. Nigel Atchison, thank you very much.
Thank you.